I have some numbers coming in today. We are at 27.2 million cases of coronavirus with at least 468,000 deaths. We are hearing right now that experts are saying we're on a downward trajectory of the cases. How are you observing these large numbers, and are we on the right track?
So I think we're definitely in a downward trend, and here up in New Jersey and New York, I definitely feel that as well. Working in the urgent care and the emergency setting, we're definitely seeing, I would say, fewer patients than we were, in March and April last year. But I think we're even seeing fewer patients than we were seeing maybe even a few months ago. So, just from a personal perspective, I do feel like things are improving, things are getting better. I think the vaccine rollout has been less than ideal, but I believe that we're going to come up with a comprehensive national strategy in the months ahead that'll help us finally get a handle on this.
Right. Are you predicting any surges in the next couple of months? We're still in February. Last year, the months of March, April, May were very, very, very awful for the north here. Are you seeing any of those trends coming in yet?
I think without a doubt we are going to see surges. Anytime there's a holiday or there's a spring break or summer kicks off again, I think people drop their guard, quite frankly, and Americans generally have shown that they are not very disciplined with regards to masks, and so I think we need a better we need more buy-in from the regular American public in order to defeat this virus. We need everybody to be pulling in the same direction. We need to be wearing masks. We need a large percentage of the public vaccinated and quickly, because as you know, we're seeing all these different strains of COVID pop up all over the world, not just here in the U.S.
Right. And you just mentioned the COVID variants here. I'd like to discuss those. Could you give us an insight into these 3 COVID variants that we're hearing about in the United States, and also especially on the South African variant? South Africa had to pause its AstraZeneca vaccine rollout due to this variant. How much information do you have about its impact here in the U.S.?
I think all these variants are likely to be here already in a significant way. With air travel and movement, it's not that we're separate communities anymore. Really, the world is a single large community, and that's how we should be addressing this and fighting this pandemic. But to talk a little bit about the different variants, the preliminary data shows that the vaccine does seem to have some protection against some of these variants. Maybe the South African variant is a little bit more different, and so it appears that it may not be helped as much by the vaccine. But that's to be expected. The flu, for example, year after year mutates significantly. That's why we need the flu shot every year. And we will likely be with this coronavirus for years to come. This is not just a 1 to 2 year thing. You're looking at likely several years, if not longer, that we'll be fighting this. So we may end up needing a booster shot for COVID potentially every year. I don't know. We're not exactly there yet, but I think the more and more we sort of learn about this, it's to me it tells me that it's going to be with us for a while.
Right, and that's the biggest concern, right? Even after these vaccines, we don't know when we will go back to any sense of normalcy. Just on these, these COVID variants, experts are worried about the fact that it could reinfect people that have had COVID-19 infection before. your comments?
Yeah, absolutely. And we've seen that already. I mean, I've had several cases of people that were infected in March and April last year, and they're coming back with another infection of COVID. So it's important that if you've been infected with COVID, that you understand that you still need to get the vaccine, that you still need to wear the mask, because regardless of your COVID antibody status, you may very likely get infected again with the same strain, if not a different strain. And we don't know yet exactly how long these COVID antibodies last. You know, some people say they last for maybe 4 to 6 months. Other people say that you have a little bit longer. So, you know, there's a lot of unknowns, and whenever you have a lot of unknowns, you have to be extra precautious. You have to be a little more aggressive in your preventive strategies.
Right, we must stay vigilant. I think that message we're getting from all doctors that we're discussing this with today. Just talking on the mask here, Doctor, the CDC is suggesting that double masking could actually be very, very beneficial for all of us, adding another protective layer to our faces. How are you looking at double masking right now?
I think that makes a lot of sense, and you know, at work, that's typically what we do. Right. You know, I'll tell you, I wear the regular 3-ply surgical mask. I should have brought props. I wear the regular 3-ply surgical mask, and on top of that, I have my N95 mask. So, you know, I think double masking does work, does help for the regular public. You know, having at a bare minimum the 3-ply surgical mask with some other mask on top, I think is a good idea. That's what we do at home with my family. But just to wear, let's say, like a cloth face covering or just the regular cloth masks doesn't really give you much protection at all. So it's important to pair up those pretty or fancy masks that you can buy from the stores with at least a surgical mask or an N95 mask.
Right, such important words right there. I think we all should know the importance of, again, double masking or masking in general. Let's now quickly talk about the vaccines here. You know, we have Moderna and Pfizer working in the United States right now to vaccinate people. I know Johnson & Johnson hopefully will get an emergency authorization from the FDA. How are these vaccines looking out to you? Have you seen any differences between them? And according to you, why is the rollout still so slow?
You know, I believe the Biden administration is working very hard to come up with a plan and a strategy, and unfortunately, there just wasn't one handed off to them, so they had to start from scratch. And they are doing the best with what hand they were dealt. It's a very, very difficult, monumental task to do. But I know they're working very, very hard to get a national strategy moving and get it out. So part of the issue is supply, right? I mean, there's not enough vaccine to go around right now. So they are prioritizing healthcare workers, frontline workers, essential personnel, and very soon, I think it'll be going to the regular high-risk public. Now, what they have to do is they have to approach that in a targeted fashion. I know that the previous administration was saving doses for saving the second doses for the for whoever got the first doses, but I think it makes more sense just to go ahead and give everybody the first dose, and if the second dose comes a month and a half later or 2 months later, I think that's okay. But I think that all available doses, as they become available, should be targeted at the high risk in the areas that are on fire, right? So the vaccine is our water, and the pandemic is our fire. So we have to bring the vaccines to the fight, to where the fire is burning. So we should use that as a tool, because it's one of the few tools that we have, aside from social distancing and behavior modification and masks, obviously. But it's important that we, again, as a society and as a community, we understand what the implications are, and how dangerous this pandemic truly is.
Right. How are you looking at Johnson & Johnson's one-dose vaccine? Do you think that could be a game changer?
Oh yeah, at this point, any of the vaccines are game changers if we have enough of them. We need somewhere between 60 to 70% of our population to be vaccinated in order to benefit from herd immunity. So I think, honestly, any of the vaccines could help us get there. We just need them to come, with enough of it. The Johnson & Johnson vaccine is really interesting because with a single dose, apparently it will prevent the serious complications, and it'll prevent hospitalizations. Now, we care about everything, right? We care that it prevents mild to moderate illness to some degree, but I think the biggest thing we want to prevent is severe illness and hospitalization and death. And so, I think in that regard, the Johnson & Johnson vaccine is done quite well. But the Pfizer and Moderna vaccines are also really, really great, showing great response rates. AstraZeneca also, even though it didn't do well in South Africa, the previous studies that I saw and the previous data that I saw from it shows that against the other variants, it does seem to be very, very effective. So, and Sinopharm and the other Chinese vaccine that's out there is a slightly different type. It's a weakened virus, sort of the old school type of vaccine, as opposed to Moderna and AstraZeneca and Pfizer and Johnson & Johnson, which have the RNA sequence of one of the, a part of the coronavirus. And that's how it generates the antibody response, as opposed to giving you a weakened virus like the Chinese vaccines do.
Do you have any comments on the Indian vaccine that's been produced in India, Bharat Biotech?
Yeah, I understand that it's a good vaccine. It is it's going to be produced in a large quantity, and it'll be cost effective. It'll be low cost. So that's also really, really important. If a single dose of the vaccine costs like $40 or $50, I think here in America, here in the U.S., we can, some people will be able to afford that, some people won't be able to afford that. But in developing countries, especially where places like India, where your average monthly salary may only be $50 to $100, they're going to need a much cheaper solution. So I think what they're doing in India is wonderful. It's great in terms of the vaccine. But I think as a world community, we're going to have to figure out how to generate these vaccines faster and more efficiently and at a lower cost, because we can't spend 9 to 12 months developing a vaccine, even though that's really good, but it's not good enough. We have to get that number down to closer to 2 to 3 months.
Right. I just have 3 more questions left here for you. There's a huge debate going on right now about school reopenings, where they're saying that perhaps teachers don't have to be vaccinated in order for schools to be open. I'd like your comment as a doctor and as a parent.
That'd be like asking me as a physician to go in and see patients without having had the opportunity to receive the vaccine. I think that's short-sighted, and I think it's important that teachers get vaccinated, and all, front-facing essential workers. I think our grocery workers, our truckers, Uber, Lyft, taxi cab drivers, all these guys, airport personnel, they're dealing with the public every day, and they need to be protected, and it's important to open up schools, but I think we have to do it safely, and while kids generally do very, very well with COVID-19, the risk is not zero. We have had kids die from COVID-19 and be hospitalized and have long-term lung damage from COVID-19. So, it's while the infection rate or the complication rate and hospitalization rate of kids is low, it's not zero.
Right. Another thing that's up for also debate right now is that the Biden administration wants to basically require anyone that's flying domestically to have a negative COVID test. What are your comments on that?
I think it makes sense. I think it's a good strategy. I believe they also made it mandatory to wear the mask at all public federal buildings and federal lands. I think that's also a step in the right direction, something that should have been done a long time ago. And it's going to take time and coordination. It's going to take the public some time also to get used to these new guidelines. The CDC is also rolling out new policies. So this is a very, very large ship that needs to be turned, and I know that our government and our leaders are working hard to do that.
And finally, my last question to you has to be about South Asians at high risk. I know we always talk about it, but what's your advice to them? And what are your concerns in general when you're looking at these individuals that have these comorbidities?
Yeah, if you have any sort of comorbidities, if you have any sort of lung issues, if you're a smoker, if you are diabetic, if you're obese, if you have any sort of chronic medical issues, I think that puts you in a higher risk category. So you should talk to your private doctor, your generalist, about getting the vaccine and signing up for the vaccine if that's possible. I know here in New Jersey there's a website and there's a phone number too that people can call to register themselves, and then the governor's office will reach out, or the health office will reach out to you as soon as it becomes available. But I think my message to everybody is to get the vaccine as soon as it becomes available, and in the meantime, just try to social distance as best as you can, and double mask, and then look to the CDC website for further recommendations. But it's really important that we stay vigilant, and we continue this downward trend, because it's unconscionable that we got to a point where we were losing more than 3,000 people a day. It just makes me sick.